Hi, this is Dr. Sudeep Roy, board-certified facial plastic surgeon here at Refined Dermatology. This video will cover the various face and neck lifting procedures that I offer here in the practice. A facelift or a rhytidectomy is a procedure that addresses aging changes in the lower face. These changes typically include heavy jowling in the face, a blunted jawline, and excessive face and neck skin laxity. I offer two procedures in the practice that address these issues. The first one is a mini lift, otherwise known as a limited incision lower facelift. This procedure is a procedure that is designed for patients in their late 30s, 40s, and early 50s who are now starting to see some early changes related to aging in their lower face. Patients will come in with visible jowls and unwanted or undesired skin laxity that they want to do something about. A mini lift is a great procedure that has many of the benefits of a traditional lower facelift, but with fewer incisions, limited downtime, and faster recovery. The procedure can also be done here in the office under local anesthesia, with or without mild oral sedation, which is essentially a cocktail of medications to help with any anxiety or discomfort associated with the procedure. A lower facelift or a traditional facelift is reserved for patients that have additional changes related to aging in their neck. These patients will have a heavier neck that would require more contouring, as well as platysmal banding or cording in the neck, which would require a more direct intervention to help improve the chin neck contour. The lower facelift is a procedure that is performed at the surgical center under IV sedation, which is essentially the sedation that is provided for routine colonoscopies and minor, outpatient surgical procedures. The lower facelift adds a small incision underneath the chin, which is not done during a mini lift, and this is to provide direct access to the neck for adjunctive procedures such as neck liposuction, as well as platysmoplasty, which is a suture procedure that enables me to help recontour the neck muscle and tighten that muscle. Patients undergoing a mini facelift or a limited incision lower facelift can expect to be pretty social at about the 7 to 10 day mark. Sutures generally stay in for about a week after the surgery, and after the sutures come out, patients feel pretty comfortable being seen out in public. Activity restrictions for this procedure are enforced for about 2 weeks, after which point low impact activities can be resumed, such as exercising, running, heavy lifting, and air travel. For a lower facelift, the recovery generally is about 10 to 14 days as far as when patients feel comfortable being seen out in public because of the additional swelling and bruising that occur right in front of the neck in this area right here. Activity restrictions for a lower facelift are similar to a mini facelift in that 2 weeks after the surgery, most activities that increase the heart rate and blood pressure can be resumed.